medical assessment. So the first thing I would say is BSI. Then I would come back on and say, is my scene safe? The evaluator would say your scene is safe. I would say, what is my nature of illness? Even though in the dispatch information they'll say you've been called to the scene of a man with difficulty breathing. My nature of illness is difficulty breathing. I have just one patient. I will keep advanced life support on standby, and I will consider C-spine. I don't think I'll need it, but I'll consider it. And I always like to walk in just so I can pretend in my mind. And my next thing I'll say as I approach the patient, what is my general impression? The evaluator might come back and say, you have a 76-year-old male who is sitting in the tripod position with sweat on his face, and you can tell he is definitely anxious. I was like, okay. And then the next thing I'll say, what is my level of responsiveness? I will say, I'll treat him like a real person. Excuse me, sir. My name is and I'm here to help you. What seems to be the problem? They'll come back and say, your patient is alert and oriented ×4 and responds appropriately. Then I'll say, sir, why did you all call EMS today? That's my chief complaint. The evaluator will come back and say, I'm having problems breathing. And I'll say, okay, problems breathing. Apparent life threats is possible respiratory failure. So now that I know that, then I'll go right into airway. I know since the patient is talking to me, my airway is patent. Now, I would start to, excuse me, sir, may I just go ahead and loosen your shirt? I'd like to take a look at your chest to evaluate your breathing. Patient says yes. I'll ask the evaluator, sir, what is your rate, rhythm, and quality? What is my rate, rhythm, quality of breathing for my patient? They will come back and say something like a slightly elevated rate with bilateral rise and fall of the chest and pink skin. Okay, I know in my brain this is a critical decision. All right, at this time I will have my assistant place a non-rebreather mask at 15 liters on my patient, 15 liters per minute on my patient. Does my patient tolerate it? The evaluator will come back and say, yes, he does. Okay, sir, excuse me. May I go ahead and check your pulse, please? So now since he's conscious, I'm going to come down here, assess his radial pulse. He will say the pulse is rapid and thready. Okay, my pulse, excuse me, sir. May I check your, I just want to put my hand on your forehead and abdomen. So now I'm checking color, condition, and temperature of the skin. This is my CCT. And they'll say something like red, warm, and moist. Okay, I know that. Now I'll say, sir, are you bleeding anywhere? Did you fall? That is my blood sweep. I like a trauma assessment. So now that I asked him, is he bleeding anywhere, I completed my C, my D in my head. It's transport decision. My decision, since it's a respiratory patient, is a load and go. Now since it's a load and go, instead of doing my rapid trauma assessment, it's now time to perform my focus history and then my physical exam. So now it's just a bunch of questions. Excuse me, sir. Can you tell me this problem? Did your difficulty breathing come on all of a sudden, or did it come on gradually? He'll say something like, it came on gradually. That's what the evaluator will say. That's the O, okay? P, provocation, palliation. Is there anything you do, sir, to make this better or worse? When I sit up, it makes it better, but if I try to lay down, it makes it worse. Q is quality. Can you please explain to me the difficulty breathing? Man, it's just hard to breathe. Okay? R. R doesn't really work because it's radiation. I mean, for breathing difficulty, so you really don't have to say R. Then you can say S is severity. On a scale of 1 to 10, 10 being the worst time you ever had difficulty breathing, rate your difficulty breathing on a scale of 1 to 10. I'm having it's a 7. All right? Time is the T. Can you please tell me how long has this been going on? For about 45 minutes now. Okay? Now I'm going to go right into the ample. You don't have to actually say the S. But are you allergic to any medicines? He tells me I'm allergic to penicillin. Are you taking any medications right now? Yes, I take albuterol, meter dose inhaler. Bing. Okay, do you have that with you? Yes, I do. Then I'll say the patient has the 5 rights are met. Okay, so that's the M for medications. P, past pertinent history. Do you have a history of any breathing problems, sir? He said, yes, I have a history of asthma for 16 years. Okay, now I know that he has asthma. So now I'm at L for the last oral intake. Sir, when's the last time you had something to eat? About 4 hours ago. And the E, events leading up to it. What were you doing when all of this happened, sir? I was outside mowing the lawn. Now I've asked I did my focused physical history. Now I'm going to do my physical exam. Excuse me, sir, can I go ahead and take a look at your chest? And then I'll ask the evaluator, do I see any decap BTLS of the chest? They'll say, no, you don't see any decap BTLS of the chest. Can I palpate for tick or any subcutaneous emphysema? Do I have any? Or any paradoxical motion? None noted. At this time, I'll take my stethoscope and auscultate apex, wheezing, Bass, you hear wheezing. Bass, you hear wheezing. Now, I will have my assistant go ahead and obtain a baseline set of vital signs. But for you all, you might actually have to do this. So I'll get out my blood pressure cuff, take a blood pressure, take a pulse, take respirations. After I get my vital signs, now that I know that my patient has had a history of asthma and I've taken his vital signs, this is a critical part right here. I would say at this time, I will call medical control. And I would let them know I have a male patient this age that has a history of asthma who has a prescribed meter dose inhaler. Patient has not taken any medication yet. His vital signs are this. Request permission to assist the patient with a dose of meter dose inhaler. Med control or the evaluator will come back and say, go ahead and help us patient assist him with his meter dose inhaler. Patient took the meter dose inhaler. Now, at this time, we're going to get into the ambulance. We're into the ambulance now. Have the patient in a position of comfort. I don't need to do a detailed physical exam on this patient because it's a medical patient. So I'm going to go right into my ongoing assessment, which is repeat my initial assessment, repeat my vital signs every 5 minutes, repeat my focus assessment on his chest and breathing, and recheck my interventions, which is the oxygen and also the meter dose inhaler. Done.